1,638 new cases yesterday, all locally acquired. Almost a quarter of those are for people aged in their 20s. We currently have 15,074 active cases. Sadly, 2 people lost their lives with Covid-19. A woman in her 60s from Wyndham and a woman in her 70s from Hume. I pass on my deepest condolences to their family and friends at such a difficult time. But vaccination rates of Victorians living with a disability are still lower than the general population, as I indicated a minute ago, at 84.4%. We've got to keep pushing through. That's why from 8th of October, all of Victoria's state-run vaccination centres will support people with disabilities to get vaccinated any time without a booking.
I'd just like to say, personally speaking, I think it's everybody's social and moral obligation to get vaccinated, and not just against coronavirus. Vaccination works, and vaccination has allowed us to eradicate some really horrible diseases in the world. And the thing is that as a person with disability, I'm much more likely to be mixing with other people with disability who are also in a high-risk group. I was left a quadriplegic 10 years ago, 11 years ago when I had an accident. So I was already in a high-risk group, and I was already getting a free flu shot because I'm in a high-risk group. So as soon as 1B opened, I was down there at my GP. I was lucky to get it with my GP. It's very easy, so I've been double vaccinated for quite some time now. But as I say, I think it's even more important for people with disability to get vaccinated because we're much more likely to be in contact with other people with disability. Even during COVID, I was in a number of projects where I was in face-to-face projects with other wheelchair users. I'm also reliant on professional support workers who come in morning and evening. And these support workers have lots of other clients, many of whom are also in a high-risk category. Now, I would find it very irresponsible of me not to get vaccinated. I would hate to think, I would be devastated to think that I was part of a transmission chain that led to somebody else who was in a high-risk category either being hospitalised or even worse, dying.